the mental health wellness doesn't mean the absence of disease, of disorder, of mental health problem, of mental disorder.
So you have mentioned something like eating disorder, sleeping disorder?
Of course, because the mental health, as I say, it affects all aspects of life.
Open Up Africa. Thoughts, ideas, real discussions by the youth on Open Up Africa.
Hello there, welcome again to another edition of Open Up Africa. And thank you for staying with us, riding with us all along from day one. Today we have something very important that usually is within us, but it's hidden. A topic of mental health. Today we are discussing the importance of mental health, plain as it is. What is mental health? You have heard about it. And special today, with us we have Dr. Chaste Uwihoreye.
Thank you.
Thank you so much for hosting us.
Thank you.
Welcome to the show. And just on my extreme right, we have Arafat, our usual suspect. Welcome, Arafat.
Thank you so much.
Are you looking forward to this topic?
Sure, I've been looking forward to meet this doctor here.
Yes.
Because I know he's going to speak something that everyone out there want to know, and maybe some people asking questions about it.
Definitely. If you go to our social media, on our tweet already, the topic is already up. The importance of mental health, as it will be coming onto your screen, the importance of mental health. Then we are looking at, even with the advancement, straight up as we go into the discussion, with the advancement of education, technology, there's still a struggle, there's still a gap when it comes to mental health. Chaste, if I may, or is it comfortable if I call you Chaste or doctor?
Whatever you... Chaste is better.
Chaste is better.
Yeah.
Yes, Chaste, when it comes to mental health, and now the youth, you know, when somebody develops mental health issues, it becomes weird. There's an English term, they say he has gone cuckoo, or he has gone mad, basically. And most of the time we say gone case. But do we see it coming? Basically, if you can start breaking down, what is mental health?
Mental health is it's a little bit a broad concept.
Yes.
And doesn't mean, if I can say, the absence of disease or disorders. The mental health, are we a little bit categorized in two things: the mental health wellness,
yes,
and the mental health problems. Let me starting by mental health wellness.
Yes.
As I was saying, the mental health wellness doesn't mean the absence of disease, of disorder, of mental health problem, of mental disorders, but it means, if I can say, the social wellness, the relationship wellness, the psychological, the behavioral wellness, the thinking wellness, the feeling wellness, and even the body wellness. So it's a kind of broad. If you don't feel well,
yes,
doesn't mean you have really a mental health life, a wellness. If you don't sleep well, if you have a physical pain, even a disease, a physical disease, your mental health is not really stable, is not good. So the mental health wellness is when really a person is feeling comfortable in all different aspects of life: thinking, feeling, body, relationship, social, even economically. If
in
economy in the pocket,
yes,
if
financial wellness,
the financial wellness, because if you are not really able to afford your renting, how really can you feel good? So it's a kind of because all those issues, if I can say, they bring stress. Even if you at work, you are not feel well, you are not comfortable with your bosses, with your task, with your responsibilities, and you feel stressful. So meaning that you don't have a mental health wellness. So it's a kind of a broad, and even within the family. I was talking about relationship, or if you wife, husband, children, if there is a misunderstanding within a family, within a system, that's meaning that the member of that system, the member of that family do not have really the mental wellness.
Yes.
So coming back to mental health problems, most of the mental health problems, I like to say, of course, scientifically and according to DSM is, I think, is a general classification, a book of classification of mental health disorders. Of course, there is a list of mental health diseases, the mental health disorders, but most of them, most of the time, they are not tested empirically by laboratory. It's not like infection where you took blood and blood sample and you mix it, and
you cannot diagnose it through blood.
Through blood, it's something. And I like to say that most of the time, people who are living that problem is the expert of that problem. Because he's the one who is feeling it, who is experiencing it, who is seeing it, and there is no empirical like the tools which have been created by scientists, which can just put like a microscope and say I can look and see it. No, it's the one who is seeing.
Wow.
Doesn't that make it difficult? Since you can't test it. It's like you said, the patient, okay, literally, I'm using the patient, the person experiencing it is the expert.
Yeah.
Isn't that madness itself? It's very confusing.
Sometimes there's some concept words, madness, and the other concept which are not really
crazy.
They're crazy words which are not good because
push somebody to stigma.
Yeah, put somebody to stigma because when you call me is a mad, meaning he's not a person. He's not a person. He's a mad. He's something else. Did you see somebody who has a malaria who is called malaria? This is a malaria. And then you start calling this is a mad man.
I get it. So if people call others mad because they have mental disorder, it's like you can say if I'm suffering from cancer, this is cancer. So I should be called cancer. So
hello, Mr. Diarrhea.
Hello, Mr. Diarrhea. So I think maybe people need to understand that. Yes. That's a great point to take. Yes. Before you call me mad, at least get to know that I'm just sick. So you should be even understanding that. You should understand that I have a problem which needs to be resolved, but not calling me that problem. Because if you call me mad, that means you are changing my personality to madness, yet it's a disease that I'm suffering from, like any other who is suffering from malaria, diarrhea, from cancer, from diabetes, any disease. So maybe people should understand that, as doctor has just phrased it.
That's really very important.
So you have mentioned something like eating disorder, sleeping disorder?
Of course, because mental health, as I say, it affects all aspects of life. Aspect of life. When you are not having really a mental health wellness, you cannot eat as usual. You know, our mental health, if I can say, our head is a, how can I say, is a computer of all life. It's the central. It's a
like the computer CPU, central processing unit.
Yes, processing of the body, of the action, of the feelings, of the thoughts, of everything. So when you have some challenges, meaning that you cannot sleep. Let me give you just a simple example. Let me say, we're talking about economic stress.
Yes.
Let me say you don't have money to lend, to pay your renting.
Yes.
You don't money to feed your kids. You are in a confusion. Do you think you are going to sleep?
No.
No.
Do you think you are going to sleep?
No way.
Do you think you are going to eat easily? And
What
you are going to enjoy your food?
What will I eat when I don't have?
Yes, but even specifically, there's some more, let me say, eating disorders where people, they cannot really eat. They cannot sleep, or they can eat a lot. When you have this disorder of eating a lot, you cannot stop yourself. That's what we call in mental health bulimia. Bulimia is a mental health disorder where people, they eat a lot, they cannot stop themselves. Say, I'm okay, I'm satisfied, it's okay.
They
You eat and
continue
you continue. That's bulimia.
Wow.
And when you cannot eat, that's anorexia. Those are the two different. So those are different problems.
Bulimia and anorexia.
Yes. Yeah.
Bulimia, that means you eat a lot.
Yes.
Anorexia, that means you don't eat.
Yes.
You feel like you don't want to eat.
Yeah.
Amazing.
Yeah.
Hashtag Open Up Africa, and the discussion is about importance of mental health. With us, Dr. Chaste, and after the break we shall continue shortly.
Open Up Africa.
Hashtag Open Up Africa on across all social media platforms: Facebook, Twitter, Instagram, and of course on YouTube as well. And today, as it comes on your screen, the importance of mental health, even in this dawn of technology and advancement, you'll notice that mental health is still something that we don't disclose. And before we went for a break, Doctor, you broke it down and you showed us different examples. I didn't know that even eating so much is a disorder. I thought it is a good appetite, like this one has a good appetite, this one doesn't eat. So when it comes to the youth, some of the time we think that mental health mostly happens to older people. We think older people are the ones who have problems, aged, elderly. But does it also happen so much? Is it typical? You have, through your experience, through your walk of life, have you seen that present in the youth?
You know, a human being goes from different stages,
Yes.
development stages.
Yes.
And at each stage, we have some health challenges, including mental health challenges, mental health problems. So from early childhood, children may face specific problem for children. You are using those extreme mental health problem, and even we have those in childhood. What you were calling madness, that's we call it psychosis. Psychosis is a mental health disorder, and it's not only a matter of adults. It's not only a matter of old people. It's a matter of a human being from childhood to oldhood. So specifically for youth people, it's a specific age which is itself called a crisis. And why is it called a crisis? Because it's a transition from childhood to adulthood, and this is really a difficult period. It's discovering, it's emotional period. It's how can I say, it's an age of construction of identity, who you want to become, and who you become to come it's constructed during that period. And when you face some confusion, some confusing aspect, including the parent relationship, including the events like let me say the traumatic events like accident, like genocide, like wars, like exiles. Those traumatic events really they challenge that period. because they make an adolescent in confusion. And it's somebody who is exploring, it's somebody who is researching, it's somebody who has so many curiosities, and when those issues come during that period, it's where an adolescent sometimes take the other, if I can say, negative mechanism, such as taking drugs, such as drinking a lot, such as conflicting with family members, with parents. So it's a specific period with curiosity, in terms of thinking, in terms of emotional, in terms of beliefs, because even beliefs, it's an aspect of mental health, in terms of relationship, so which really need a special attention to take care of mental health of adolescent
now when
people.
You mention that, when you talk about that, just in our adolescence, we are in our adolescence stage, or most youth are in the period of, in the window of discovery. It means it also requires some expertise on how to handle them. I can believe that institutes like schools, teachers are trained, they go through that experience of handling the kids. But most of the time in society, children are with their parents. How many parents are experiencing that? Most people in parenting are on to also discovery. Don't we have a danger that is lying ahead still?
Of course. You know, parenting, you use it to be like, I don't know if instinct or it's English, instinct, but now it's a science. Parenting, it's becoming science. How to know how to parent, how to care a child at a specific stage of life. Yes. And most of adolescents, and as we are saying, they face so many challenges.
Yes.
And we see during that period, it's where most of adolescents who have mental health issues, they got different somatoform disorders, and those who were used to call hysteria. Hysteria is no longer used, is also a stigmatization word concept, but the adolescent, they feel pains. So it's, as we are saying, it's, now even the government of Rwanda is, I think it launched last year the mental health program within the school system. Mainly in secondary schools, where psychologists will be recruited, teachers will be trained, the government will hire the school counselors, so that really they integrate mental health within the school system, so that really those adolescents they can benefit from those programs. Of course, even the parents, because it's not only schools. I was saying there is a lot which happen within school, within the family system, yes. and the parents know how really to care for their kids. I was receiving this morning a family, and he's a adult, and there is a crise, there is a very strong misunderstanding with their daughter of 16 years old, and they don't know how to do. They say you cannot be allowed to phone, you cannot be allowed to social media, you are still a child. And an adolescent say, no, I'm an adult, why not using the phone and why you? So the parents, they should know really how to handle those issues.
Is it a conflict of, we could say conflict of generations, where because parents at 16 they didn't even know what a phone was?
Yes,
some privileges.
Yes.
They feel today.
Yes, it's a generation and the technology. You know as well as the technology, because technology is bringing issues.
It brings itself.
But I think the relationship between parents and children is what is bringing this all, according to me. Because these days, though, the world has this modernity, there is technology and all that, but parents have not yet embraced creating that bond between their children. If you have, Andrew, I want to tell you that if you have a close bond with your child, if you are friends, if you tell her that please don't use the phone because of A, B, C, D, because the phone will lead you into this and this.
Temptation.
If she is your friend, she will understand you better. But if she knows that you, that parent who doesn't care, is that parent, she can't tell you that I know you my father but you don't care. She can't tell you that, but she will have that in mind, that though my father don't want me to use this, but he doesn't care about me. So she will always be conflicting with you, wanting to do what she wants because she knows more, or at the end of the day you don't care. So I think maybe if parents can bring this kind of close friendship with their kids, that's when they can even be able to remote them, to tell them, you know what, do this. Because I know if you are my friend, it's very easy to direct you into another way than if we are not friends. I think maybe friendship is also needed among parents and children.
Friendship has to be there. We take it for granted, I think. Do you think so?
Maybe
Yes.
doctor can add on.
I mean the parents child friendship.
Because that example
Most
you've
of the
given
time-
us, I think if that child was a good friend to one of the parents, maybe a mother or father,
They would have
the one
sorted
that
it out.
they are friends would be easy to
Convince.
convince this girl.
Of course. I totally agree. We parents should create friendship rather than let me say being authorities.
Yes.
And
rather than-
authorities
yes.
do this, don't do this, don't do this,
I
don't do
give
this.
birth to you.
You know, during the adolescence, it's just a negotiation.
It's a negotiation.
It's a negotiation.
And the
It's a-
negotiation is
it's a-
possible when you're friends.
Yes, it's friends, and when you hear each other.
Yes,
Yes,
sure.
you take time to talk, to tell to your kids, but you take time to listen to them because they have sometimes a reason, and you have to understand their reason.
Just
Yeah.
aren't you creating another conflict that side? Because there's a parent who's like, no, you have to listen to me. I feed you, I gave birth to you, do what I say.
That one is an ancient parent.
No,
I would say that's an ancient parent. Because the modernity where the world has reached, you cannot order a child.
No,
You cannot. Even they have their rights. Their rights are enormous. You understand? They have many rights, which they can even sue you.
Yes.
So you need to go slowly.
Slowly, and even those young, they're so young, they sometimes have reasons. Yeah, you have to
You have to
negotiate.
listen to them.
You have to listen to them. You of course you have to teach them. You have to educate. You have to give them information because there are so many information they don't have. But you have to listen to them, and you negotiate and you come up with a decision.
So Open Up Africa is the hashtag across all social media platforms, and with us Dr. Chaste, who's a psychotherapist and an expert in mental health. After the break, we are going to read some of your comments as we wind up. This is Open Up Africa.
Open Up Africa.
Welcome back from that break, and the topic is the importance of mental health with Dr. Chaste with us. Thank you for joining us. And on our social media platforms, on Twitter, there is a topic already as it comes to your screen. The importance of mental health. Even with the advancement in education technology, society hasn't yet openly embraced the issue. Of course, Dr. Chaste broke it down. There's that need of even being friends with parents being friends with their kids.
Yeah.
So there's a possibility that the parent might be having a problem.
Of course. Diaz, let me starting by statistics. The research done by the Ministry of Health in Rwanda, they confirmed that 12% of the general population, they live with major depression. And almost 28% of the general population, they suffer from post-traumatic stress disorder. And of course, there are a big number of the general population which is living with comorbidities. Is a problem associated with different problems. So let me give you those just numbers. Yes. But also, the research found that only 5% of the people who need support, they go to seek support in different.
Only 5%.
Only 5%
of
the people who need support.
Who need support? Only 5%. The one who are seeking the treatment.
The treatment. So meaning that
so we have 95 who are not coming for treatment.
Who are not coming.
So what do you think that needs to be done to ensure that at least all these people comes in for treatment?
Of course, mental health is mental health. Sometimes there is some challenges. The challenge of stigmatization, the challenge of people who don't understand that their problem can be healed, can be treated, and can be separated from their problems. This morning I received an adolescent, it was a girl, she's saying, I could not really understand that this problem can be treated. I can even understand that there is somebody who can understand my problems, because mental health, there is something which is created into maybe in the heart, maybe in the head, in the thinking, in the feeling, as I told you, which cannot be tested. And sometimes the people, they have fears to share, to talk, to tell people in the society, because if I say I have sadness, if I say I don't sleep, if I say I feel like this, how my friends will take me? They take me as a mad person. They take me abnormal. I'm not normal person. That's so. There is a need of awareness, first of all. Awareness, continuing explaining what is mental health, and coming back to the question about parents. The parents, I would say the first one, even considering our Rwandan context, we are coming from genocide context, and most of parents, they are the ones who live the situation of the traumatic event the country passed through. So meaning they may have, I will not say that everybody who live the traumatic event will be traumatized, but it will be affected. So the parents, the adults, we are the ones who passed through that history.
So we pass it to our children also.
And the intergenerational trauma, it can be transmitted to generation to another, from a generation to another, and you will not treat a child without treating the parents. And even in mental health, there is what we call how can I say, in French we say patient designated patient. So when a system, when a family, when parents are sick, sometimes a child, an adolescent, he's the one who manifests the symptoms of a sick parent, a sick family, and sometimes you will see, for example, you will find so many young adolescents, I like to say that, who are taking drugs, who are addicted to drugs, but they are just manifesting the symptom of they are coming from family which is sick.
So you're trying to say that if my parent is suffering from mental disorder, I'm likely as a child to also fall into that category? Somehow you are likely to fall. That's the transgenerational.
For
example, if my parent is a drug addict,
yes,
so a child who is a boy or a girl is probably going to be a drug addict.
Of course, if it's not taken care of.
Yes. If that child is not in another line of not going into that,
yes,
so the parent can pass it to the child.
To the child.
Wow.
That's so they need to be cared.
Sure.
And sometimes people, they just go for treating children, and then they don't consider parents.
So on Twitter there's a comment, Kiza Donata says, I think the commonest mental health issue in our society is anxiety and depression, and these are hard to realize even by the person suffering from them. Information like how to recognize these mental health with the issues within oneself, prevention and cure should be made known.
I think the doctor can briefly tell us about how to discover anxiety and depression. How can I discover that I'm suffering from anxiety and depression disorder? Simply.
That's simply. That's simply. You discover anxiety, depression through your feelings, through your thoughts, and through your behaviors. Let me give you an example so that you can understand. If you start really feeling you are useless, you are useless, there is no reason to live because you are useless. So that's the start of depression and anxiety. If you feel you cannot do, you feel weak every time, there is no purpose of life. There is no purpose of life, and that's your feeling. That is your thought. And even you start thinking it's better dying because there is no purpose. Suicidal thoughts start coming in. So it's and at that time you will not sleep. You can't sleep.
So immediately after, you're trying to say that immediately when you start feeling that you're useless or you're living for no purpose, you should immediately seek for treatment. Thanks for that.
Yes.
Maybe that's taken. Another
point is said is called J Trice 96J. He says, for me, I think that it's common in the youth, mostly nowadays, and it's because of their because they are jobless on their end. So they end up taking drugs, every type of drug from beer to cocoa. Parents are busy looking for money.
Yes, I agree. Unemployment is another issue that...
Yes.
Because parents are not there, they are busy doing other things. So kids.
Yes.
Unemployment creates depression, and you start to feel like you
need to
your life has ended. So
when people get when you talk of drug addiction, does it also come from a perspective that somebody wants to hide, they want to confide somewhere?
They don't have inner peace, and when they drugs, it's something which really bring inner peace. Inner peace, what do I mean? It's a pleasure.
Doctor, when you say it brings inner peace, somebody will be like, let me go for inner peace.
Yeah, of course, because
start running.
That's artificial inner peace. Because you don't have this inner, you don't have peace. You feel really no purpose. There is
when you take drugs, they work with your hormones and then they create that peace inside.
Of course,
you
because
go high.
They call it going high.
It's the drugs. They increase the hormone called dopamine. Dopamine in the mental system, and that's dopamine. When it's increased, the pressure is increasing. When you see people, they are. Let me give you just an example of doing sex. When people are doing sex, they increase dopamine, and you feel well, and it relax. And the drugs also, they increase the dopamine, but when it goes off, immediately you feel you want drugs. That's addiction, and then your system, your mental health, your neurotransmitter system is addicted. That's how drugs are. And when this dopamine is increased, of course, the inner peace you feel free.
Doctor, maybe as we wind up, can you please tell us the categories of people that you mostly receive at your clinic? The categories. Do you mostly receive parents? Do you receive children? Do you receive youth? Which categories of people that you seriously receive, and which category do you think really is not coming and you think needs to be?
Our organization is specifically a child and youth focused organization. We do support mainly children and adolescent young people, and those are the most people we receive, and that's why we receive so many young people addicted to drugs. So we receive young people who have depression and post-traumatic stress disorder, but also we have we receive also some parents adult because of working with children. There is a proverb in Rwanda saying that rushanye nawe mwana imbabazi abashaka kumurya, meaning that you cannot work with children without working with parents, with families.
You can't show too much empathy to the children than the parents.
Than the parents, yes. That's right. So those are the people we receive here. Yeah.
So
you mostly
what is our take home? Like any last words, advice?
The take home, I will start to what we discussed at the beginning. A problem is a problem and a person is a person. We don't have to confuse a mental health problem with a person.
That is what we usually do.
Yes, a problem is a problem and a person is a person. Those are two different identities. A person identity and a problem identity, which can be separated, and a person become again a person. That's one. The second one, their services. Their services which can support people who may feel yes, they exist, even from health facilities, health centers, district hospitals, so private services like this one. So people should go to seek services, and mental health problem can be treated and healed easily and quickly. That's what I can say.
Wow. Okay. That's great. Maybe what I can say is that people should understand that if you're suffering from any mental disorder, your life has not ended. Don't drag yourself into things that you feel will make you happy. As doctor has said, that taking drugs will increase your dopamine, but at the end of the day they will get down and then you will still want them. So that means it's not a solution. So we need to seek for treatment. That's what I can say right now.
Thank you so much. Thank you so much, Chaste.
Thank you.
The issue has been importance of mental health. I think we have got some light onto it, and I think we need more, doctor.
Of course.
Next time, definitely we shall have him. And thank you so much for tuning in. Till next time, this is bye for now.